The 2026 guidelines are very clear. Healthy lifestyle changes are the foundation of cholesterol management for everyone at every age, and they should begin in childhood. Even if you end up needing medication, lifestyle changes make those medications work better and lower your overall cardiovascular risk in ways that pills alone cannot do. So, why does lifestyle always come first? Lifestyle changes can lower LDL by about 20 to 30% if you adhere to those changes. They also reduce blood pressure, blood sugar, inflammation, and body weight, all of which affect heart disease independently of cholesterol. They have no copay and there are no side effects. What does the evidence show about diet? Saturated fats found in red meat, butter, full fat dairy, and coconut oil raise your LDL significantly. Replacing them with unsaturated fats like olive oil, avocado, and nuts can lower your LDL by 10 to 15%. Soluble fiber found in oats, beans, lentils, apples, barley binds cholesterol in the gut and removes it. Aim for about 5 to 10 grams of soluble fiber daily for a 5 to 10% LDL reduction. Plant sterols and stanols, which are added to certain margarines, orange juice, and some yogurts, can block cholesterol absorption as well. About 2 grams per day lowers LDL by 5 to 10%. Omega-3 fatty acids like fish oil are especially effective at lowering triglycerides by about 20 to 30%, but it has to be at prescription doses. And it has a more modest effect on LDL. The Mediterranean and the DASH diets both have strong evidence for reducing cardiovascular risk, and they are specifically endorsed by the 2026 guidelines. A simple rule of thumb: fill half your plate with vegetables and fruit at every meal, choose fish or plant protein twice a week, and swap butter for olive oil. Exercise. Well, aerobic exercise like walking, cycling, swimming, dancing is especially effective at lowering triglycerides and raising HDL. It has a more modest direct effect on LDL, roughly 5 to 8%, but combined with diet, the effect can be meaningful. The recommendation is at least 150 minutes a week of moderate activity, like brisk walking counts, resistance training like weights, resistance bands, body weight exercises adds benefit for blood sugar control, which in turn helps the entire lipid panel. Even light activity helps. If you can't do 150 minutes yet, just start with like a 10-minute walk and build up. Any movement is better than none. What about weight management? Even a 5 to 10% reduction in body weight can meaningfully improve your entire lipid panel and blood pressure. Weight loss lowers triglycerides dramatically, and it raises HDL as well. What about smoking? Smoking lowers HDL and damages the lining of your arterial wall, which accelerates the buildup of plaque. Quitting is one of the single highest impact changes you can make for your heart if you are a smoker. HDL begins to rise within weeks of quitting. What about alcohol? Alcohol raises triglycerides, sometimes dramatically. No more than 1 drink a day for women or 2 for men, and less is better if your triglycerides are already elevated. Now let's talk about sleep and stress. Poor sleep and chronic stress raise your cholesterol levels, which worsens the entire lipid profile. Aim for about 7 to 9 hours of sleep every night. Stress management, whether through exercise, mindfulness, or therapy, has measurable cardiovascular benefits too. Now, what lifestyle changes cannot do? If you have familial hypercholesterolemia, your liver is genetically programmed to overproduce LDL. No diet is going to fully fix that. If your 10-year or 30-year heart risk is high, lifestyle alone may not be enough to reach your target. And that's when medications become important allies, not a sign of failure. Never stop a cholesterol medication to try lifestyle first without talking to your doctor. They work together, so stopping medication can significantly raise your short term health risk.